50 million Americans with no health insurance.
Okay, so that is, if you're not aware of that film, that is Michael Moore's film. It's called Sicko. It's made back in 2007, and it's really an overview of the universal healthcare system versus the American healthcare system. Here in New Zealand, I think we are regarded a little bit as a socialist country and one that has a free healthcare system. It's not really free, it's almost like a hybrid between the system, but it certainly has its flaws. Let's go over and have a look at the diagram right now. Okay, so this diagram is actually for elective surgery within the public system. So first I think we need to explore the term elective and see what that means. According to the health.government website, an elective surgery is or are medical or surgical services for people who do not need to be treated right away. Actually, that isn't the definition of the word elective, because the real definition is chosen by the patient rather than urgently necessary. So we can see that there's this change in language, in fact almost like a marketing term, because what they're trying to sell the idea is it's okay for people to wait because they're on the elective list for elective surgeries. And I think this gives the public an idea of they should be waiting. It's our tax money. Why are they getting elective surgery anyway? So that might be some of the public response to this idea when they use the word elective and waiting lists. Elective almost applies to anything other than if you've had a heart attack, you've stopped breathing. These things aren't elective, they'll start treatment straight away. But first off in this process is I'll just bring it up here so I can read it. So the primary point of contact here in New Zealand is what's called the GP, or general practitioner. It's really your doctor that you go to, and you might pay around $35-40 to go and see your doctor. Appointments vary in length. They can be between 10 and 15 minutes, and longer appointments are also available. However, you may get additional charges for longer appointments. First off, the doctor's going to assess you and determine whether you have enough points, essentially, to get specialist care. So some people who might be interested in gaming the system might describe their conditions as being long-term, might describe their conditions as worsening, getting worse. So this is more likely, particularly when it's unknown what the problem is, that you'll be referred on to specialist treatment. If it sounds minor, then chances are that you'll be, how to put this, given a little bit of advice, perhaps given a prescription. In my case, in my daughter's case, it was advice, and that was just stop coughing, and you can try cough lozenges. Well worth $40. Anyway, for a condition that's been ongoing for 6 months. So anyway, after you, let's say a specialist referral is not required, you're given a little bit of advice, sent away with that, and you're always told, come back for reassessment if, things get worse. So next, if you do manage to get an assessment, well, if you're not happy with the advice the doctor's given, you really have two options. You can go get a second opinion. So you can go to another doctor, and probably get similar advice. Or you can move on and go private and have a specialist have a look at it. In the case that I'm talking about, the specialist would charge up to $350. The disadvantages of going into that private specialist is that he doesn't have all the resources and equipment that the public healthcare system does. So he may not be able to as effectively diagnose it, but every case is a little bit different. I'm not saying that every private healthcare specialist can't diagnose it. But in particular cases, your private healthcare professional really only has equipment around what's making money and what insurances are covering for. So if the specialist does discover what is going wrong after you've paid your $350, is they will actually refer you. Well, you'll have two options. You'll be able to go into private healthcare. Hopefully you'll be able to go into private healthcare to have that fixed, if they do it. Other than that, you're probably going to get referred back to the public system, and you'll get to see, guess what? A specialist who will then reassess the situation for you. Here in New Zealand, for medications, what happens is we have an organisation called Pharmac that negotiates with basically drug companies and negotiates the price in particular situations. This can take many months to make these negotiations and get the price cheap enough, a price that they're happy with. Anything they're not happy about, they just won't provide, and people will have to pay full price, whatever it costs, without any kind of negotiation or anyone to negotiate on their side.
But to us, as we look across the river here, why don't you think we believe that? What's wrong on this issue with us?
Okay guys, just to summarise, I just want to give you some final thoughts about this, and I think that Mike Moore's documentary Sicko was one-sided. It portrayed the US system as evil, bad, etc., and that the universal healthcare system, wonderful, helps a lot of people. And I think that reality is that both systems have flaws, and you can always look for ways of improving things. It's just my thoughts. A lot of my viewers for this vlog are from New Zealand. Just over 50% of my audience is New Zealand, so I'd be happy if you guys want to comment and share your thoughts about the New Zealand healthcare system, or if you're from overseas, leave a comment about your healthcare system and your thoughts on it. Thanks. Bye.